Hello and welcome to the True Man podcast, the podcast designed to create a generation of self-defined men. Today, I'm joined by Dr. Suren Naidoo. Suren, it's an absolute pleasure. How are you doing?
Great, Lewis. Really, thank you. Thank you. It's a real pleasure to be on your Truman podcast. I think I've seen some of your podcasts and heard some of them. They're really amazing. So I'm looking forward to being involved with you today.
Awesome. I'm super excited for this one too. We're touching on a topic that I'm really interested in. It's something that I've not really brought to the podcast yet, sort of looking at sort of men's health and I guess longevity as a little bit of a broader spectrum of what we're going to get into. But I think, as always, Suren, in your own words, what makes you a man?
Interesting question, Lewis. The thing is, I've been in medicine now for 35 years plus, and what I've learned really, it's not just about gender or biology, what in terms of what makes you a man, of being testosterone, high testosterone, and giving the macho effect. I think it's a lot more about character and how you show up in the world. So, important things I would say are things like ownership, integrity, having a purpose in life, having leaving and being yourself. I think that's the most important thing in terms of uh, being a service to mankind. In other words, end of the day, what you want to do is to help people, to help them in terms of their health, because I'm in medicine, and also you need to have certain amount. And being vulnerable is not a weakness. And I think the fact that if you can own up and say, look, I am suffering with something, that means that's more powerful rather than suffering in silence. And I think having that's it's not a weakness. So that's what I feel. A man really should be able to not be able to discuss things openly rather than saying, well, I'm afraid, I don't want to discuss any issues. So that openness is quite important, and to be transparent and also to discuss things with their partners.
Yeah, I really like that. I think there's a lot of pride sort of left in
Yeah.
in being a man and really sort of trying to solve it ourselves a little bit. I think, and always struggling to ask for a little bit of help. So
I
it's
think that
nice.
that macho effect has to be taken away. That embarrassment, that feeling of, I don't want to discuss this with my wife, I don't discuss this with my partner, I have a problem. And lots of men who fail to do that will end up with serious issues in terms of mental health, prostate cancer, because they don't want to go and see the doctor for a simple examination or having a blood test, and they leave things too late. And that's when problems arise.
And I guess that's sort of how you've found yourself where you are now. As you sort of said, you've been a medical doctor now for 35 years. But why don't you sort of explain to the audience what it is that you're sort of doing now in the men's health space?
Yeah. So that's thanks for that, Lewis. So when I was a GP working in my practice, I was mainly the cardiac lead and the diabetic lead. So I would see a lot of patients with diabetes. And lots of these patients would come to me with certain symptoms, which I really couldn't explore in depth. I mean, and I really didn't put things into, I would just see them for diabetes and off they would go. They'd come for the cardiac problems and off they would go. We just didn't have the time to put the whole thing together. And now, since I have been in retirement for the last 4 years, I've sort of looked at this again and said, what have I missed in the last 35 years? What could have done better for these men? And yes, patients with diabetes or pre-diabetes can have symptoms which show they have a high vascular risk, a cardiovascular risk of getting heart attacks. And that triad of cardiovascular risk, of that triad of diabetes or pre-diabetes leading on to symptoms of, say, loss of libido, erectile dysfunction, and then leading to silent heart attacks. That triad really is going to need to create that awareness for people so that they will take action at an early stage and they will seek help and get a good response from the GP. Or I've got my own program now, which is Manstrong 2, which is a program set out to help these people.
Do you think men sort of as they age, they start to think that this is just their their body's slowing down. They think this is just normal. Like, why do you think men put off sort of visiting the doctors around, I guess, in that sense, less serious things? So maybe like erectile dysfunction or maybe symptoms towards pre-diabetes.
See, a lot of these symptoms men will experience, like fatigue, loss of libido, increase in belly fat, lethargy, tiredness, and they think, well, it's just part of natural aging. But what they don't realize, these are silent markers. These are drivers. These are drivers of insulin resistance. These are drivers of, I mean, the belly fat we're talking about is visceral belly fat, that which wraps around the internal part of your organs. And it's that fat which is a high cardiovascular risk. And people then become less mobile, the weight increases, blood pressure rises, and eventually they get a heart attack. People say well, it may even develop erectile dysfunction. And erectile dysfunction is an embarrassment to think, well, it's just part of normal aging, but it's not. It's a silent marker for a cardiovascular risk factor. You're more likely to get a heart attack 2 years down the line because the penile vessels are much smaller than your coronary vessels. So if these penile vessels are becoming blocked due to endothelial dysfunction, the inflammation of the vessels, and blockage with cholesterol, etc., and cholesterol plaques, these patients are more likely to get heart attacks 2 years down the line. So it's really getting the message across, don't be embarrassed, don't suffer in silence. You really should seek help at this early stage because these conditions can be reversed and they can save your life.
And sort of typically, when do these sort of issues start to arise for men? Is this something that you should be looking at from early on, or does it happen as you sort of actually do age?
Well, for most men, from the age of 40 onwards, I should be looking at this quite seriously. So a lot of executives or men who are working hard, building up the business to create wealth, creating an income, leaving a legacy for the family, but they may not be there, they may not be able to enjoy it because they will suddenly develop a serious condition, not realizing that this condition is building up. So it's important for them to understand as soon as that they get any of these type of symptoms, which I've mentioned, such as fatigue, weight loss, fatigue, increase in weight, belly fat, brain fog, all these patients, really, they should be seeking help at an early stage. It's not just natural aging. And don't be embarrassed because it's something which we can actually reverse. Now, for example, patients with hypertension, they may not realize they've got high blood pressure because high blood pressure is the tip of the iceberg. And a lot of people really should be having regular blood pressure checks, having the testosterone measured, because testosterone, again, is an important hormone in the body, not just for sexual function. It's a hormonal problem because testosterone, if you have a low testosterone, apart from the sexual part, it affects your cognitive function. It can also lead to heart attacks. So it's important that people realize this. And this message is not quite out there. And I think having this podcast today, I'm hoping people will understand a lot more and start to ask questions.
I think men's health seems to be in a bit of a weird phase right now, where we have, I would say, people like myself that have sort of taken on this idea of being a lot fitter in their 30s and trying to be as active as physically possible. Whereas if you look at sort of generations that have gone by, sport may have been done in school or university, and then as family sort of arose, they slowly declined and never sort of got back into it in any way, shape, or form. Is there sort of a preventative sort of step to all of these? We obviously talk about pre-diabetes and diabetes and cardiovascular disease. Usually, when you Google those kind of things, some of the first things that pop up is go for a run. Like, what are some of the preemptive sort of measures that men can start to take?
Yeah, but lifestyle changes are so important. And actually, what you're saying is correct in a way because exercise is the mainstay of longevity. Exercise is a medicine. It's better than taking medication. And our studies have shown that sometimes patients with pre-diabetes, and if you exercise, you don't need to go and take metformin for your diabetes. You can obviate that just by exercise. And what we're looking there is really 3 times a week of cardiovascular exercise and resistance training and improving your cardiorespiratory metabolism, your cardiorespiratory function, because what we're measuring is the VO2 max, okay, the volume of oxygen at the maximum level. And that's really quite important. The higher your VO2 max, the better your longevity, and you'll improve as you get older. So even doing a few minutes a day of just resistance training, and this can be done with high intensity interval training. This is really important, just to do a few minutes a day to sort of get your body exercising, and this will really prevent you from declining.
When you talk about medicine and the sort of alternatives that are available, do you think there is a sort of disconnect between the NHS and what that provides for men, well, all patients really, when it comes to sort of all diseases really? Is it sort of medication first, not really ask any questions? Do you think the NHS misses a few things when it comes to what's needed for all round health?
I agree with you. I mean, when I was a GP in practice, although we had exercise programs, but that's not pushed enough. And I think the reason is people know the knowledge is there. The knowledge, a lot of GPs have this knowledge, but it's really a time factor. When I was a GP and I got to see a patient between 10 to 15 minutes, and you got 20 odd patients to see, for the morning, and you got extra work to do and visits and so on. The GPs are just overworked and overloaded. And what happens is that we're tick boxing. So we got certain things to meet to create an income. So we have these quaff boxes. We need to tick off, have you had your blood pressure? Have you had your blood test done? Have you had your cholesterol measure? We just tick the box. But we don't have the time to sit down and explain to the patients. There should be sort of an exercise manager in the practice. Somebody who's like a physiotherapist or a manager is interested in exercise and saying, look, go and see this patient, sit down and have an hour with this patient, and he can do a lot more than I would do for you in 15 minutes. So go and sit down and discuss exercise program, exercise, talk about nutrition, talk about reducing your cholesterol, improving your bad cholesterol like your triglycerides. All these things will help in the longer term, and it will improve patients' health, and it'll save the NHS a lot more money if people start to think, well, yes, there's a lot more to it other than just taking a tablet. I don't want a prescription. A lot of people, when they go to the doctor, they don't want medication. Because once you start medication, you have the side effects of the medication. You're stuck on it for life. And we're actually killing our patients with more medication because of the side effects. And what we should be doing is doing the reverse. We should be saying to our patients, lifestyle changes, we know the standard things, smoking, alcohol, etc., and weight loss. If we can improve on those with exercise, because exercise is a medicine in itself.
Yeah, I think so. I think there's maybe the other side of that is some people might be like, I went to the doctors and they said go for a run, and I didn't didn't think that was very useful either. So I guess it's two sides of the same coin. But I think
But but Lewis, if we get the time to explain to that patient, look, this is the reason why I'm asking you to go for a run. Show them the metabolic changes which can take place if you go and exercise 3 times a week. What is going to do to your overall body in the terms of long term? Because you're improving muscle mass, okay? Muscle mass and strength are so important because improving your muscle mass and strength will prevent you from improves your cardiorespiratory function, improves your VO2 max. Also, as you get older, you're building quality muscle strength, and muscles absorb glucose from the system. The more exercise you do, weight training, etc., improves your metabolic syndrome. So it stops that metabolic dysfunction of diabetes. Is absorbing the glucose back into your system from your system. So you're not getting that effect. This is why people who exercise are more likely to reverse the diabetes. And
so.
I think they will accept that a lot better than saying, okay, I just said go for a run, but no, that's not it. But if I'm going to explain to you why you're going to go for a run, you'll accept that a lot better.
Yeah, for sure. I don't really know a lot about type 2 diabetes, so I guess for me, I run, I exercise every day. I'm currently doing a challenge, which is why I'm running every day. But
Amazing.
I like what is type 2 diabetes? How does it come into place? What does it do? And then how does exercise reverse it?
But type 2 diabetes is basically, it can be genetic, or these days it could be, we see it younger and younger because of poor nutrition. So it's basically what happens, your pancreas in your body produces insulin to, to, to basically to treat the high levels of sugar, okay, in your body, or glucose, and this reduces and brings down to balance. But once you develop insulin resistance, then you get inflammation, and chronic inflammation causes endothelial dysfunction. By that I mean the lining inside your blood vessels become inflamed. And when they become inflamed, you get cholesterol buildup and plaques, and this leads to complications. So diabetes can affect all your blood vessels from head to toe. There's risk of inflammation in the brain, okay, blood vessels leading to strokes, leading to dementia later on. In fact, dementia is now called type 3 diabetes. That's how it's labeled, type 3. Then coming down, it will affect your heart because of the coronary vessels becoming blocked. Okay. Then further down, it affects your abdomen in terms of you got belly fat, which is being produced. It affects your pancreas. You can get inflammation of the pancreas. It can affect your liver. You get fatty liver disease. Coming down further, it can affect your genital organs, affecting you with erectile dysfunction. Affects the other blood vessels going down to your feet. You can lose your toes due to inflammation and gangrene of your toes. So it affects every blood vessel in the body. It affects your kidneys, which are missed. You get people going to kidney failure, and you get high blood pressure because of this, and because of heart disease. Your blood pressure tends to rise, so that increases your risk of a heart attack and a stroke and kidney failure. So diabetes is a really nasty condition. And the incidence of diabetes is increasing and increasing, throughout the whole world because of obesity. People, okay, we know it's genetic, but it can also be due to obesity and poor nutrition and lack of exercise. That's
So
just in a nutshell.
yeah. So what are some of the early signs of pre-diabetic?
But people will present with fatigue, tiredness, loss of energy. They may have infections, could be skin infections, recurrent skin infections, for example. They may have topical skin infections on the arms or legs, or they may present with genital infections like candida, etc., or yeast-like infections. And people may realize, well, I'm getting these infections, but I may even develop other infections like chest infections as it gets worse, because the immune system starts to drop. It's the immunity of the people, of those patients are going to suffer.
And what would you say to, say, a man in their early 40s who may be seeing signs or may be concerned about this? What are some of the, would you suggest seeing someone straight away, or would you suggest starting on sort of a little bit of a program before you went to see someone?
I think, especially if they've got a strong family history of diabetes, the parents have diabetes or the brothers and sisters, they should go and see the GP straight away, okay, or seek for help, or contact the British Diabetic Association online. There's plenty of information which they could read about. Patients who are experiencing symptoms like this, 40 plus, 45, sort of mid-age, and with other more serious symptoms, they definitely need to go and get help. Okay, they should try straight away looking at the lifestyle, looking at what the stress is causing, how sleep is being affected, because sleep again is another risk factor. Because if you don't get enough, if you don't get between 7 and 8 hours of sleep, again, this is a cardiovascular risk. Your cortisol levels will spike, you get insulin resistance, and this can also lead to increased cardiovascular risk and diabetes. So I would say suggest to these patients, especially mid-age patients, and also females for that matter, because they are likely to have, around mid-age, more likely to get heart attacks, purely because in females, which I know this is a men's health program, because the estrogen levels fall. But in men, the testosterone levels will also fall. So it's that hormonal imbalance and the metabolic dysfunction which is taking place has to be addressed. So it's very important that they should have a simple blood test. See, they can have a urine sample to check for other conditions like kidney issues, but they should definitely have a blood test, a urine test, see the GP, symptoms to be explained to them in detail, and what the treatment lifestyle program should be all about.
Do you think testosterone is underplayed in society? Or to ask that another way, do you think the understanding of testosterone is lacking significantly in society?
I think it's both. I think there's certainly a lack of understanding of testosterone because I think people, when they think of testosterone, they think of anabolic steroids and pumping up and getting big muscles and guys in the gym injecting themselves and doing all sorts of things, getting stuff illegally online. But testosterone is a really important hormone. And people, especially diabetic patients, they have a natural reduction in testosterone, which needs to be addressed. And people don't pick that up because really what they think, well, it's just my diabetes is causing my erectile dysfunction. No, you've got a combination of things. You've got a lack of blood supply, it's hormonal. You've got a lack of testosterone. So these things need to be addressed, need to be reversed so that you can actually improve your sex life again. Also, testosterone is important for cognitive function. It's shown that the testosterone levels are low, people are more likely to eventually end up with Alzheimer's disease or dementia. Also, patients who are at higher risk of cardiovascular disease when the testosterone levels are low. So it's so important, really, that we should have a better understanding of testosterone and not be afraid to refer patients to endocrine specialists if we don't have the knowledge on how to treat it. Endocrine specialists will be able to help them with this, or even urologists for that matter, should be able to help them. And this is where I've created a program called ManStrong 2, which addresses these particular issues and try to create an awareness of patients to say, look, these are important symptoms and now is the time to be treated.
Yeah, for me, my understanding of testosterone was non-existent until I ended up having conversations with people in the men's space. I think it's something that's missed from sex education from like 14-year-olds all the way through to men in their 40s, 50s, and 60s. I think it's almost painted as this negative hormone, this sort of aggression hormone. And that's quite scary when you say all those things are linked to low testosterone. So you would almost feel shame to go and try and boost your testosterone if you didn't want to come across as that. Obviously, there's a lot of, like you say, a black market sort of space for testosterone and sort of, like you say, anabolic steroids. Are there any sort of natural ways to boost your testosterone?
Exercise, going to the gym will help, certainly. There are supplements out there to help you with testosterone, like magnesium. Magnesium is an important supplement. Helps with sleep, helps with testosterone production, boosts your immune system. Ashwagandha, which is a nice supplement also, which can also help you with testosterone production. These are natural supplements, but at the end of the day, they're not high enough. They don't give you that higher level to reach what you need, because it's important to have a baseline measurement of what your testosterone reading is. Testosterone can range anywhere between 5 and 29. So if you measure your testosterone first thing in the morning, it's got to be done at a blood test in the morning between 8 o'clock and 10 o'clock in the morning. No point measuring it in the afternoon because you get a different type of reading. So the correct time to do it is between 8 and 10 in the morning, fasting if you can. And if you have that reading, and if it shows a reading of 10 or 11, it's going to be classed as normal. It's what we call low normal. Ideally, I'd like to see a testosterone reading, depending on the patient's age and prostate tests, the PSA reading, which should be normal. I'd like to see a testosterone reading, somewhere reading of 21, 22. And from my experience, those are the men are going to benefit most with a good level of testosterone in the body, not the patients with a reading of 6 or 7, because that's what is low. Doctors won't prescribe because you're in that range of 5 to 29, and people will say, well, you're in the normal range. But studies have shown that when you get a testosterone reading at that level, it's not going to help you with optimizing sexual performance. It's not going to optimize your vascular endothelial function. You need that higher level, somewhere like 19, 20, 21, that sort of age, that sort of level. We don't want you up at 29, 30 plus, but we want you at that sort of range, which will be much more efficient and produce a lot more the potential for improvement and benefits are much better at that level.
Do you think that men want to talk about this more now? Do you think this is becoming more mainstream?
Well, I think at the moment, a lot of men are talking about mental health, and that's because it's publicized. You've got royal family, you've got celebrities all talking about mental health. And that's, at one time, nobody discussed mental health. It was a stigma. But I think people are just on the verge, if you like, on the cusp now of realizing there's more to men's health in terms of just longevity and improving health span and health, improving your lifespan and health span. It's not just about that. It's more about looking at your metabolic syndrome, looking at your hormonal dysfunction, looking at more globally, more holistically, and saying, look, we're not just treating one thing here. We're treating you as a whole. There's a lot of factors going on, and we need to address those factors. So come and see us. It's important you come and see us. Don't be ashamed. Don't be afraid to discuss things. People are afraid about prostate cancer. They're afraid to have a rectal examination. They think it's embarrassing. But just a simple examination and a blood test will save a patient's life. And I can give you a true story where I had a patient in a clinic when I just started about 2 years ago. And he came in to see me. We started a men's health clinic. A gentleman of age 60, strong builder, no symptoms, absolutely fit and healthy. Came along to see me at the clinic. We did a full examination. We did the blood test, and he was found to have prostate cancer, stage 2, without any symptoms at all. Now, if he didn't come in for that check, he'd have gone on to have metastases to his bone. He'd have presented with severe back pain, and he would have lost his life. It could have spread to his liver and he'd have had serious complications. Fortunately, he didn't need to have surgery. He had radiotherapy and chemotherapy. And I saw him a couple of months ago, and he's absolutely amazed. He's getting back to normal, and his wife can't be more happier than each time I see her, and to thank me and say, "Look, you've actually saved my husband's life." And this is a true story. It's amazing.
This sort of like this ego of men, or like you say, shame or embarrassment, and that maybe ego is what's coming next. So I sort of spoke about the sort of generation that's coming up. This sort of like, we're fit, we're fighting, we're exercising longer, we're sort of looking at what we're eating, but there might be another tweak to the lifestyle, so they may still drink, or they may still party, like the sort of Peter Pan syndrome, if you will, of sort of aging male population, kidless population, I should say. And like you say, even when healthy, we sort of talk about, it's sort of referred to as sniper's alley, right? That sort of age, sort of 45 to 55, that you can sort of be struck down in your prime. And it's really important that we have these conversations, and it's important that men act on these things. I went to a talk a while ago, and it was around suicide, but one of the parts of this talk was quotes from people that had attempted, or quotes from suicide notes, and it was around mental health, and it was someone who had attempted suicide in the last 6 months, and their quote said, "I don't judge men who go to therapy, but therapy is not for me." And I think there might also be a little bit of an element of that creeping into men's health as well, where it's like, I don't judge men who go and get their prostate checked, but I'm okay, I'm fit and healthy. Do you see that as like a future concern? Do you see that for like future generations? What's your sort of take on that?
Yeah, what you're saying is absolutely correct. I mean, we saw a lot of that in the early stages of mental health problem. People just don't want to accept, or don't want to come in for help, and it's too late. And those are the people who will go and commit suicide, because those are the people who remain silent. They are the dangerous ones. People who cry for help or come and seek help, they are not going to go and commit suicide. We see this over and over again, especially in men. Men are more likely to commit suicide than females, and because they don't seek for action. In a similar sort of vein, when we're talking about men's health and cancers and different types of, especially prostate cancer. That fear, that negativity about not, or that macho effect, as I said earlier on, we need to have, being vulnerable is not a weakness. It's not a weakness. If you want to be a man, you should be more submissive and admit the fact that, look, I've got a problem, seek help. It's not that macho effect. We shouldn't be having that thought. It's not testosterone and building big biceps and so on. I'm a strong man. Even you're a strong man, it's a simple change in your hormonal balance can lead to some serious metabolic dysfunction. So try and be more positive about your health, because it really depends on your long-term view and how you want to live and what sort of legacy you want to leave for your children or your grandchildren. You don't want to be at the age of 45, 50, you get a stroke and you can't play with your grandchildren. That's the last thing you want. You don't want to be at the age of 60 and develop prostate cancer and you pass away and you've lost your life. You haven't seen your grandchildren grow up. So those are important things. I mean, I know in my own family, my dad was a doctor. I can mention this. He didn't enjoy his retirement. Basically, continued working, trying to create leave a legacy for us. But he died at a young age. Didn't retire from surgery. Developed renal problems, and he went into renal dialysis, and he died. So it's just one of those things of life. It just shows there's more to life than just working 24 hours. You need to have a balance. You need to create that balance, and don't be afraid to seek help.
One of the things that I really like about this sort of new wave of longevity, or like biohacking, to use some of the buzzwords that are sort of thrown around, is the data that comes with it. And I think that sort of excites a certain type of man as well. Do you find that with your patients? Do you find once they start to find out about numbers and how to improve them and things like that, how do they sort of play with those numbers a bit?
So I'm glad you talked about that, Lewis, because what I've created is an app. It's called Vital-Health app. And this app measures patients' vital symptoms. So for example, temperature, pulse, blood pressure, oxygen, weight, cholesterol measurements, blood test measurements, PSA, prostate scores, erectile dysfunction scores. This app is really useful in terms of patients who really want to look after their health. When at the beginning of we have certain blood tests which we carry out in our system, in our program, and this is then entered into the app, and they monitor themselves. So they can monitor the blood pressure once a week if necessary, depending on their medical condition. They can measure the sugars, they can measure the cholesterol every 6 months, and they can see a trend. And it's that trend which we're looking for, which will give us early warning signs of disease. And that's when we can capture them at an early stage and reverse the conditions. So using the app, which can be downloaded from the Apple Store at the end of March. At the moment, it's a web app, but once you get to the end of March, it'll become a native app, and you can actually download that for a small subscription fee. And basically, you can monitor yourselves on a regular basis. And by monitoring yourselves, it gives you that accountability, and also it shows changes when you're taking ownership of your health. As I said, one of the early things I talked about was ownership and integrity. Ownership of your health is so important. If you take that ownership on, you're more likely to succeed, and you're more likely to live longer and have a better quality of life.
Yeah, I was going to say, sort of giving that power back and sort of letting you take full control over your life a little bit. You talk a bit about sort of increasing lifespan, and I think some people might be listening to this and go, well, I remember my granddad, he was in his 80s and 90s, he couldn't get out of the chair. Like, I don't want to be that old and that frail. Like, what's the difference here? What's the difference when it comes to aging here?
Well, what we're doing now is, again, all boils down to exercise. Even sitting in a chair, you can exercise. And by doing a bit of physical exercise every day, this will give you stronger muscles. You're unlikely to fall, unlikely to end up with a fractured hip Okay, improves your bone strength. So we're talking about muscle mass and muscle strength, and you need both. So the greater the muscle mass and muscle strength, it's shown that these patients are more likely to have a longer life and a better quality of life compared to patients with more lean mass, and are more likely to have falls, more likely in terms of death. They're 2 times greater risk of dying early because of the risks. And these are proven facts. These are shown by studies which have been carried out.
It's so interesting that like little things, almost like I guess butterfly effects, can really have a huge impact on the life that you're living and the life that you're sort of going through. So like not exercising in your 30s and your 40s increases the chances of X, which increases the chances of Y, and then um, all of these other things. So having low muscle mass, like it's for me, it's something that I'm really interested in at the moment. It's something that, like, post my depressive state and my sort of like suicidal ideations, I went from wanting to commit suicide to wanting to live for as long as physically possible in the best way I could. So I'm well on board with all of this, and I'm sort of probably a big advocate for it, and it just makes me think that the younger and the earlier that people start to take this seriously and start to actually think about the repercussions of what they're doing now and what that might look like in 20 or 30 or 40 years. And that's a really hard mindset to get around, right? I think that's something that, based on society, is quite, we're very selfish and very self-obsessed, but in the now rather than the future. Do you think there's anything that can be changed to sort of help with that?
Yeah, what you're saying is absolutely correct, and I'm 100% in agreement with you. In terms of what we should be looking at is planning for the future, like in anything. If you have a business, for example, if you take a life insurance, you're planning for the future, aren't you? You want to know what's going to happen to you in the future. You just don't want to spend all your money now in one day, and that's it. You've got nothing to live for. And the similar sort of thing, we should be taking our health, because really, end of the day, your health is your wealth. And if you can't appreciate your health, because if you don't have good health, how are you gonna progress in the future? You're going to become a burden to your family, to your state, to the state we're living in, causing untold costs to the NHS. So these are the things people should be thinking about. How can we improve the state of the nation? How can we improve my health so that at the end of the day, I'm not a burden to my family? I don't want my family at the age of 60 to see me lying down, in a stroke bed, or have I had a heart attack and I end up with heart failure with a pacemaker, and I can't walk 10 yards. I'm going around with an oxygen tank because I can't breathe properly. No, I should be looking at myself and take ownership of your health. That's so vital, to take some ownership, have some integrity. And I think integrity is important in this phase, because if you don't have integrity and having ownership, how can you survive? How can you live sometimes with yourself? People should be looking at all the lifestyle factors, not just diet, not just exercise, although exercise is one of the most important things for longevity. They should be looking at the whole holistic picture and improving the environment in the terms of what we eat, because again, environment plays a huge factor in terms of pollution, etc., which will affect our health for the future. So it's a multitude of factors. And I think the more people start to think along those lines, we're going to get better results for the future. I hate to think what my grandchildren are going to face, in 50, 60 years' time with what's going on in the world.
Yeah, and I guess just sort of touching on what I might say is the elephant in the room. You talk about environment, but one thing that's sort of not touched on and is probably, correct me if I'm wrong, probably links to a lot of the downfall of some of the things you've already touched on, is stress, the sort of stressful space that you put yourself in. Like, W- Can you explain some of the links to stress and some of the things that you've already discussed? So diabetes, cardiovascular, and low testosterone.
Stress increases stress and lack of sleep. Because if you are stressed, you're not sleeping well. So stress and lack of sleep is going to increase your cortisol levels. So cortisol, you're going to get insulin spikes. So when you get these insulin spikes, eventually you'll end up with insulin resistance. This then creates inflammation of the vessels, what we call endothelial dysfunction. It's the lining inside the blood vessels which become inflamed. And this is not there's different types of inflammation. There's acute inflammation and chronic inflammation. Acute is, for example, say you have a fall or you cut yourself, you get a red mark on your skin and that becomes all inflamed. That's all what we call acute inflammation. That's treated quickly with, say, antibiotics or infection, or you treat that and sort it out. But what we're talking about is chronic inflammation. And it's that chronic inflammation which continues, ongoing stress. Anytime you get stress due to emotional stress, physical stress, mental stress, lack of sleep, this inflammation gets worse. It changes the hormonal balance, which is quite an important part of which we need to talk about another day. But certainly this chronic inflammation, which goes on, creates that nasty inflammation inside the blood vessels, and the blood vessels, of course, become, instead of having a smooth lining inside, they get plaques build up on them. Plaques then lead to blood flowing through a river, if you like, with boulders, and this creates ripples. Then eventually you get cholesterol plaques, which then lead to stroke.
It's all linked. It's all linked, which is good to know. Which means that it's reversible as well, right? It means that
It is.
I think maybe looking at sort of the men's health space as a whole, or maybe just the men's space in general, sort of over your 35 years in medical as a medical profession, what do you like right now? Like, what do you think is really good about the space? What do you want to see more of, or what are some of the things that you kind of want to see less of?
Well, what I'd like to see men taking ownership. I want to see more men coming out. I need to see celebrities. I need to see more people like mental health talking about men's health. There's a lot of celebrities talking about menopause for female health. I like to see men talking about men's health. I mean, if men have that fear, I'm not going to see the GP because they think, well, that macho effect. But you get men then coming out and say, well, look, you don't have to have that fear. It's a simple thing. It's a simple blood test, a simple examination. It'll save your life. So I'd like to see more and more of that coming out in the public, in the press, TV adverts, TV programs, when people are discussing things. As part of the programs, they can introduce men's health rather than showing that all about, they need to have some new sort of specific type of things about health, and more in a wider variety, and to try to get patients more engaged in this. Less of is that macho effect. I don't want to see people thinking, well, I'm fine, I'm fit, I'm healthy, and and then you end up dead. So it can happen. To be honest, I've seen this so often. I've seen, say, some of my own patients, who didn't come in for checks, who didn't come in, and patients over the years, I've warned them and I've told them, look, there are conditions. You've got conditions. You need to have certain checks done. But sometimes they refuse to come in. They miss the appointment with the nurse. They miss the blood test, and you can only remind them so often. But if you can take a horse to the water, but you can't force the horse to drink. So it's the same sort of thing in terms of health. We can encourage patients, give them the knowledge, educate them, and empower them to take action. That's the important thing. We're going to give them some sort of ownership, and they should have the integrity of, well, yes, I want to do something to help myself.
Awesome. Suren, it's been an absolute pleasure. I've really enjoyed this conversation. If people have liked what they've heard and they want to find out more, where is the best place to find you or find out more?
Well, I'm on LinkedIn, Suren Naidoo, LinkedIn, Dr. Suren Naidoo. I can give you my LinkedIn profile. There you can also look at vital-health.ai, which is the app, which is it's an amazing app when it comes out on the Apple Store. For the moment, it's a web app where people can monitor themselves. I've just created the Man Strong 2 program, which is a 5-hour step program, which is to reset, reignite, rebuild, reclaim, and rise into the man you want to be. And in that 5-step program, there are different elements of what we do. And it's not just giving you medication, blood tests, accountability, coaching, and putting you on the right path to the exercise programs to put you on the right path to improve your longevity.